Thank you so much for joining us today for the careers interviews.
Thank you.
Before we start today, so can I ask you for your name and for what your role is?
Okay, my name is Shota Myojin. I am working in AMR division in WHO headquarters, and my job title is technical officer. My job assignment is sponsored by the Japanese government, and I'm in the junior professional officer program right now.
Okay, and can you tell us a little bit more about what that involves?
Yes. So about the JPO program.
About both, so the JPO program and your work is the
Okay.
title.
So my working is about my job is in the unit called multi-sectoral partnership and program, partnership and collaboration. Sorry. So it's, as Hajim explained, AMR is a global program, and we need to tackle AMR problems collaborating with other UN organizations and other partners. So my work is collaborating with the other UN organization, including Food Agricultural Organization (FAO) and UNEP. It's United Nations Environment Program, and WHOCC, World Organization of Animal Health. So we are doing the work collaborating with these organizations, and we are saying that this is a Quadripartite Joint Secretariat on AMR. So in our MCC unit, multi collaboration and partnership, I always don't remember the name of the unit, but this MCC unit is the working as a secretariat of this Quadripartite Joint Secretariat on AMR. And among this QJS, my main work is updating the global action plan on antimicrobial resistance, and as well as we are trying to establish a scientific panel of antimicrobial resistance. So these two are the biggest works I am doing. And about the JPO program, I don't know you know or you don't know. At least when I was a master's student, I didn't know this program. But JPO program is called Junior Professional Officer Program. This is sponsored by each member states, each country. And as far as I know, I think there is around 40 or 40 countries which are joining this JPO program. So if you are selected by a JPO program, or your salary or the money you need to, this will be sponsored by your donor country. So if you want to join the JPO programs, at least your home country, your donor country need to be joining in the JPO programs. So I think it's very worthwhile to check if your country are joining the JPO program. So there are several requirements which you can join the JPO program or not. At least in Japanese, my hometown is Japan, my country is Japan, and I'm sponsored by the Japanese government. And at least the requirements from the Japanese government are you need to be under 35 years old when you are applying for this program, and you need to finish your master's at least. And if you have PhD, it's very good, but at least master's is the minimum requirement. And you need to have at least 2 years working experience. So these three were the minimum requirements. And the Japanese JPO programs has a lot of job selections which you can apply. And when I applied, I was interested in the public health field, so I was looking for the job description which I can be related. So I found my position which I am doing. I thought this is really relevant, which I was doing, so I applied for that, and I was fortunate enough to be selected by the Japanese government, and I am here now.
Wow. Okay, so it sounds like it's been quite an interesting journey then, and just so that people watching have an idea. So your background, you have a medical background.
Yes.
Could you tell us a bit more about kind of your the steps that you took even up to that point?
Mm-hmm. So after graduating from medical school, I started my clinical training, and I started my general clinical training for 2 years, and after that I decided to be a pediatrician, so I did a pediatric training for 3 years, and after that I decided to be more familiarized, more like a subspecialty like infectious disease, so I decided to start my pediatric infectious disease training, and these years included more than 9 years. And after that, I decided to go to Imperial College London to start my master's course in epidemiology. The motivation for doing that was during my clinical training, I was involved in clinical research about AMR in Japan. So before joining public health, I had some experience and knowledge to be involved in the clinical research about AMR. So this combination brought me to, I wanted to more exposed to public health field, especially I wanted to be involved in pediatrics and infectious disease. So this combination brought me interest in more like AMR or vaccine and more global health field. So I decided to join public health. But I thought it's very challenging and it was very difficult to participate in like a WHO or other organization before obtaining any international master's degrees or at least. So I decided to go to Imperial to get a master's as a first step.
Oh, okay. And what's one thing, so it sounds like you've got a lot of experience in AMR.
Mm-hmm.
What's one thing you wish the public knew about antimicrobial resistance?
So my experience, which I had in Japan, was more like a primary care, and it was like doctors and patients, and it was trying to have more like a good strategy for like antibiotics, antimicrobials, but in the global health field, it's more like experiencing having more like strategy and the policy making, and I thought it's very interesting to take a look what kind of people are working in the region and what kind of people are providing this kind of document and policy document, and which I was always referring to. So although I had some experience and knowledge in MR, but the viewpoint which I had in the past and right now is very different. So that's what I am thinking is really interesting.
Okay. And for the public who are kind of looking in, and there's a lot of talk about AMR.
Mm-hmm.
What would be your kind of one takeaway? What was one thing that you'd want them to remember about antimicrobial resistance in and amongst all of this information that seems to be going around about it at the moment?
The moment, so there is a huge stream that One Health approach is very important, which means we need to focus not only human health, we need to pay attention to animal health and agri-food sector and environmental sector. So to tackle with AMR problems, we need to collaborate with all of these three sectors, and we need to work on collaboratively. And I think this viewpoint is something we should really focus on in the new future.
Okay. And so my kind of follow-on question from that is, with kind of the collaboration that you've been doing on antimicrobial resistance, what's been the most kind of rewarding part of that? What have you found to be the most satisfying part of that?
Yes, so when I was working in Japan, I didn't have any opportunity to work with the other sectors people. So although I knew that it is very important to work collaboratively to tackle AMR problems with those people, but I didn't have any chance to communicate with them. So now I am in the mainstream to collaborate with these people, and I am learning what they are thinking and what they put in the priorities from their sectors. So it is very interesting to see. So although I have some knowledge of AMR, but it always brings me a new viewpoint from them. So I think it is one of the biggest rewarding one I have right now.
It's that constant learning from other people, right?
Yes.
Okay, well, thank you so much for speaking to us today. So one final question.
Yes.
Is what would be your one piece of advice for aspiring students or young people who want to follow in your footsteps, maybe apply to the junior professional program or work in AMR?
Mm-hmm. Okay. I think it depends on the individual, I think. So I think first, everyone should think what you want to do in the future. I think the audience of this video is interested in public health, I believe. So, but in the public health field, there are a lot of working opportunities. So if you are interested in working in international organizations such as WHO or more like other academics or private sectors, there are a lot of options. So I think it is important to think about what you want to do, and but at the first I think it's really difficult to think about that. So it's great to have a network with your colleagues or your supervisors and have a communication with them, and please be open to any opportunities. And when I was in Imperial College London, I didn't have any knowledge about JPO, but actually my other friend told me this opportunity, and I looked about the JPO program in Japanese government, and I found that it was okay, so I could apply for that. So I was very, very fortunate to find this opportunity, and yeah, please be open to any opportunity. This is my message.
Thank you so much. Thank you.